think we've hit the 2-minute mark. So Janie, do you want to kick us off?
Yeah. So for those of you who don't know me, my name is Janie Thompson. I'm the president of AFP Colorado. AFP stands for the Association of Fundraising Professionals. We are a membership organization that is dedicated to advancing philanthropy and helping you become better professional fundraisers. So we offer a lot of education opportunities similar to this one for our Colorado community. And we are really pleased to be partnering with MPW Strategies to offer multiple webinars on fundraising in the coronavirus era. So with that, I will turn it over to John Pepperdine, who is with MPW Strategies, and he'll kick us off.
All right, thank you, Janie. Well, thank you so much. We really appreciate the partnership, and it's not just AFP Colorado, but it's also Colorado Nonprofit Association. And anything we can do in this time to help folks get a better handle on fundraising, and including outreach, communications, anything within the nonprofit realm during these really trying times for everybody. And so with that said, I'd love to welcome Laura Larson, our guest today with Stride Community Health Center, but also Patrick Gaines will be joining us, and then Matt's going to be working the questions and answers. Hi, Matt.
Hello, how are you doing?
Good. So, and just housekeeping here, we're going to be taking questions. If you go to the bottom of your Zoom link, you'll see Q&A up there. Type those in, and then if you see something you like, you can upvote it. You can certainly use the chat line, and that's fine. It's just we're really looking at the Q&A, just to kind of corral all these questions. We are recording this, and we'll be sending out the recording on Monday. AFP will be sending out the recording as well, and I believe CNA. But if you've signed up for this webinar, you'll be getting a link, at least from MPW, but also possibly from AFP, where to download the recording. So with that said, I'd love to just jump in and ask Laura to let us know what she does and what Stride Community Health Center does in the community.
Absolutely. Thank you so much, John. Good afternoon, everyone. My name is Laura Larson. I'm the Vice President of Development at Stride Community Health Center. If you're not familiar with Stride, we are what's called a community health center or a federally qualified health center. And this is a model that started back in 1965 as part of the civil rights movement to address health outcomes and health needs in vulnerable communities. Stride is one of 1,400 community health centers across the United States and one of 21 here in the state of Colorado. And we provide services to more than 51,000 individuals per year. Those folks are predominantly low income, so they fall below 200% of the federal poverty level. Many of them are either on Medicaid or are uninsured, although we do see patients with some private healthcare plans, as well as Medicare and CHP+. Our whole goal and focus is to make sure that we can create access to services for those vulnerable populations by providing care for medical needs, behavioral health care needs, dental care, as well as wraparound services and supports like care management and patient navigation. So the work that we do here in the metro area, and we serve a 4-county region, Adams, Arapahoe, Douglas, and Jefferson counties, is really, again, just making sure that we're getting those folks connected to care, especially now in this incredibly critical time that we're in. Healthcare is becoming even more important than it ever has been, and we're really proud to be able to do that.
Well, I mean, and the whole point of what we've been talking about is you're on the front lines. You're providing testing, you're providing follow-up to the testing, you're providing information, which is vital. If you go to your website, and I love the fact that it's front and center, and the huge communication element of what you do is important. Your role is actually pretty interesting because Matt and I have worked with a lot of development professionals that oversee development, and they usually work very collaboratively with communication. A lot of them have bits and pieces of communication, but you have a dual role. So before we get into questions, I would love you talk personally, and I would love to have people hear from you how you juggle that dynamic of being a communications person that sometimes has to wear that hat, and then sometimes being the development person.
Sure. That role for me, it came about in a very odd way. I had been in fundraising for quite some time. I worked in the nonprofit sector since 2003, and I've always been on the grant writing side of things, programmatic side of things, and that is, really part of what drives me is being able to be a part of programs that provide impact to folks. When I started here at Stride, I was the grants manager and advocacy liaison for the organization. And so really my roles were both grant writing, fundraising events, and then grassroots advocacy, which is, again, really important, especially for our populations. We want to ensure that our patients feel like they always have a voice for their care, a voice for the services that they're receiving. A lot of times they feel marginalized and not heard. And so that was a really important aspect of my job. Communications was something that this organization, which has been around since 1989, had never had formal marketing and communications until 2016. And it was at that time we shifted away from this build a building and people will come mentality to really how do we get the message and the word out there, right? We want to be able to communicate what we're doing because it has such incredibly important impact in the communities we're serving. But also, how do we connect to people that may connect to our mission and want to be a part of the work that we're doing? That wasn't happening in a structured way until that 2016 mark hit, and I was asked to carry the torch for both the fundraising and grant writing side of things, as well as communications and marketing. Certainly wasn't my background, but I can tell you I've learned a lot in the last almost 4 years that we've had marketing and communications as a part of the organization. So it's been a very interesting hat to wear, but there are so many parallels and crossovers between what we do on the philanthropy side as well as what we do in marketing and communications. And I know we're going to get into that a little bit more.
We are, and I want to welcome Patrick. Patrick, thank you for joining us. And it was interesting what Laura just finished up saying, because I think it was a webinar a week or two ago. We were talking about the sometimes blurred line between communications and development. And just this week, and Laura, I'm going to embarrass you, but you received a grant because of your efforts in communications, quite frankly. And when I say your team, Stride, everybody from top to bottom. And so I know it's always the royal we with you, Laura, but I think, take pride in your work. I think that you've done a good job. Patrick can speak to that too. And Matt and I, we all talk about how everybody works collaboratively. And if you have communication sending out the message to everybody, but then you follow up with development message that's more specific, but still in line with that message, it worked out. And so I want to say congratulations to you from the recent grant because of your communication efforts. So.
Thank you. And I would certainly love to touch on that a little bit more, John.
Yeah, please do.
Everybody a better understanding of what has been happening at Stride in the last 6 weeks. When the COVID outbreak and pandemic really began creating some momentum here in Colorado, Stride really knew that we needed to step up to the plate and take action. We wanted to be the front runners in what we were doing in community health. And so within a matter of 2 weeks, we set up drive-through COVID testing at 2 of our locations, one in Wheat Ridge and one in Aurora. We set up telehealth and teledentistry, which we are now able to provide not only to our current patients, but new patients as well, who may need access to care and they don't know where to go. We've done all of that. We are now getting ready to do next week curbside prescription pickup for patients. So rather than having to walk into one of our locations, especially if they are a vulnerable population, if they're over the age of 65, if they have chronic health conditions, if they've been exposed to somebody that has tested COVID positive, we want to create a way in which they can still access their medications without ever having to step foot in our locations. So that's launching too. And what we found is that we've gone through this really, really rapid pace of deploying different types of programs and projects that benefit the patients and the community at large. So when we did that, we really decided from a communication standpoint that part of what we needed to do was help share those messages. And as John alluded to, we've certainly kept messaging updated on our website. We created a separate tab for COVID-19 resources and information. We've created a separate tab for telehealth, and we're constantly keeping that up to date. But the other thing that we've really done is created some significant momentum with social media. So between our Facebook, LinkedIn, and Twitter pages, we've been posting regularly, sharing photos, sharing impact.
Can you move a couple of slides so people can see what Laura's talking about?
Yeah. There you go. Really sharing with people What are we doing in the community? How are we doing it? Where are those services being offered? And we've had so much participation in, especially in the social media posts where, we had a post when we first started the drive-through testing that had a reach of nearly 15,000 people, which for us is very, very large. Our following and our reach is usually not to that level. And so we've seen that. We've had folks that have shared a lot of our posts, and we've increased our followership behind that as well. And that helped give us some additional media presence, both with local media, national media, and even international media. We were featured in a Daily Mail article in the UK about 3 weeks ago. And so with all of that, we were outreached by a foundation, a national foundation, for grant funding. It was a $100,000 grant. It was by invitation only. And what we actually found out just a couple of days ago was that this particular foundation was providing funding to 12 community health centers. So those 1,400 communities across the United States, was 12. And the reason they did that was because they reached out to our National Primary Care Association, the National Association of Community Health Centers, and they said, hey, who should we be paying attention to right now? This is what we want to do. And because of those posts that national association saw and shared, they knew how much was happening at Stride and what we were doing, and they recommended us for that funding. And had we not been taking the time to really create a very strategic direction with communications, the likelihood that we would have been selected for that $100,000 grant would have been lessened for sure. So communication had to be a part of the core of what we were doing as we're developing the new normal that we're existing in now, and it's definitely paid off.
Well, I wouldn't mind. So part of this is we always like to have the idea that what works for some people may not work for others, but there might be some similarities. And I think Patrick might be able to talk to Boys and Girls Club. You've been pivoting quite a bit, Boys and Girls Club of Metropolitan Denver. Patrick, do you mind commenting about how you've been pivoting similar to what Stride has been doing and how that's been paying off too?
Yeah, I'd be happy to, John. Thank you. And hello, Laura, and hello to all our guests. Thank you. And my apologies for being late. I just ran into a little technical error. I'll answer the question, and then I am going to throw it back to you, Laura, so be ready.
Okay.
Boys and Girls Clubs at this point, we waited about 3.5 to 4 weeks before we were able to kind of assess some of the more acute needs that were coming out of our community, and particularly our families. So many of our families, obviously all the kids were sent home, but their parents too were sent home, and many of them ended up being put on furlough or laid off. And it took about 3 weeks for us to really understand, and for them to understand what some of their acute needs were financially: food insecurity, basic needs at home, personal hygiene, transportation costs, and so forth. And so we're addressing those right now. And we've had a wonderful community response to that, meaning we stated to the community through social media, just as Laura mentioned, our families need help. Can you help us help them? And the response was tremendous. However, we also are cognizant of the fact that we're moving into a next phase in May, once the governor and the federal government, the CDC, decide what the latest social distancing guidelines are. Now, our initial response was to move into what we were characterizing as a recovery phase. But in the last 24 hours after hearing Governor Polis's latest press conference, thinking about recovery right now is sort of like thinking of recovery in the eye of a hurricane, because the eye of the hurricane feels calm and predictable, but of course you know that the next and maybe even more fierce wave is coming. So Governor Polis, I think it was yesterday or 2 days ago, referred to moving into a stabilization phase. So here's my question for you, Laura. We're wrestling right now with how do we continue to raise money for acute needs today, knowing that we've got to get back into some kind of stabilizing operations and continue to raise money for that. We're grappling with that right now, and I'd just be curious how you are approaching it on the front lines of healthcare.
Sure, and I think that's a really good question, Patrick. For Stride specifically, there was never a time for us where we've ever said we have to stop providing healthcare. that's not an option for us. We have too many patients that rely on us to provide them the care that they need. And so we knew the model would look different. And it's, part of the reason that we launched telehealth was because we knew we needed to give patients a safe way in which to do that. And so we've actually been having conversations. We're also kind of moving into this next phase of what happens with this new normal. We know at some point, some things may return and feel a little bit more like what we're used to. But we also know that a lot of what we're doing right now, we're going to have to continue to implement as we move forward. That just for us is never going to change. Telehealth is the way for us to move. With that said, so thinking from a funding perspective, we know that we have needs that we need to fund for now, whether that's personal protective equipment, whether it's adding time to make sure that we have staff coverage. Staff are getting sick, staff have families to take care of, and so we have to look at how do we balance that, because one of the biggest problems we had when all of this erupted was that we had a significant decrease in the number of visits that we were having with patients per day, right? That's where our revenue source comes from. It's about 45% of our revenue comes from patient-generated revenues. And so with that kind of quick knockdown, we knew that we needed to come in and do some micro campaigns around fundraising, immediate fundraising needs, and doing a lot of the aggressive grant writing for COVID-specific grants. But at the same time, we have to continue to look at what are we going to need moving forward. We know right now we can't do fundraising events the way that we normally would. We can't have our 5K run. We're still uncertain if we're going to be able to do a golf tournament in the fall. And so we have to look very creatively at other ways in which we can do that, whether it's an online medium to do a virtual 5K run or a virtual golf tournament, a virtual silent auction, whatever that might look like. We're still trying to figure that out. But we're trying to also stay a step ahead, knowing that, okay, with the grant funding we have in place right now, we know where we can shift money from other existing grants. And we've been given a lot of flexibility and latitude from grant funders to do that. But we're really trying to, again, kind of just put those ducks in a row of where are we now, what do we know we need to plan on, and how do we continue to have good relationships with our funders and have those open conversations with them about what type of funds do we need to keep that business sustainable. And same thing with our donors. What do we need? We need those donors not just today, but we need them 6 months from now. We need them a year from now, and we have to continue to work on the engagement piece and the relationship piece with those donors to ensure that we keep them part of the work that we're doing long term.
Great. Matt, do you want to give us the next question here? And just to remind folks, if you've got a question, go ahead.
Oh, I was going to say the same thing you're saying, John. I'm going to say, we really want to keep these webinars. This is participatory, and we want to hear from you, our audience and attendees. And we will, not only questions you have for Laura, John, Patrick, or myself, just fundraising, what's going on, what you can do to raise money during this time or engage donors. We want all those questions, but also to hear what you're doing. So as you hear Laura and what they're doing at Stride, if you and your organization are doing something similar, we want to hear that. Or if you have different ideas of the current environment and how to deal with it and how to work through with it, please let us know. And again, there's that Q&A button down at the bottom, or it might be at the top of your screen. And we want you to use that Q&A feature, not the chat feature. So please, questions and comments through Q&A. If you see a question or comment you really like, click that thumbs up. So that will pop to the top and let us know that's audience favorite. So again, let's, we're community here. We want to grow. We want to think about how we can really all get through this. So we definitely want to hear from you. So thanks.
Yeah. So for that, I will jump into the next question. How do you balance the immediate fundraising need with the, fundraising 101, building long-term relationships? How do you do that, Laura? And then later, next to you, Patrick.
So I realize I don't have to tell any of you this, but everything we do is about relationships over and over and over again. With our micro campaign efforts, we have had a number of new donors who have never been interfacing with the organization previously. And so a lot of what we do, you know, we're giving them auto-generated thank yous, but I take the time to actually send a personalized email to every single one of those donors, not only to say thank you for the gift, especially during this critical time, but also so that I can find out how they were connected to us. Was it through a staff member? Did they see it on social media? Did they see it in a news article? Where did they come from? And how do I continue to engage in that dialogue with them and get that information from them? And so that's a really big piece of it, because I don't want them to just be a donor today. I want to see them back again 6 months from now, and a year from now, and 5 years from now. I want those folks to value and appreciate what Stride's mission is and what we're doing, and stick with us for the long term. So it really starts with that relationship building for me. The other thing that we've been doing with those donors is making sure that we're automatically opting them into our newsletter that goes out. Currently, we've been doing it on a weekly basis just because there's so much change going on. But when we get out of this phase, we have a regular monthly donor newsletter that goes out. And so we opt them in. They've got to opt themselves out if they're not interested, but at least it's a way that we can start the conversation and keep them connected to the work that we're doing. We also have been doing things like handwritten cards, because again, I think we need to create multiple touch points along the way as we're going through this to keep people connected and engaged. And we've also taken the time to outreach longtime donors, because although our new donors are incredibly important to the work that we're doing now, we have a lot of donors, whether those are business sponsors of our events or whether they're individuals that have been connected to us for many, many years, and they're important. They're not just donors to me, they're people, and they have families and lives, and they're being impacted by this pandemic as much as we are in the face of the work that we're doing. And so taking the time to shoot a quick email, get on the phone with those donors and just check in on them, not asking them for contributions, not asking them for help, just treating them like people, because at the end of the day, that's what they are. They're people who care enough about our mission to be a part of it. And I want to make sure that they know that we care just as much about them in this process. So again, it's, for me, it's nothing else other than the relationships. That's the focus right now.
Great. Patrick?
So I'm gonna put a plug in for our Facebook page. So there is a Facebook page, and maybe I don't know if we can maybe post that in the chat room right now. But this is a call for ideas, and the caveat to that call for ideas is be careful, because when you submit your ideas, it might just get you a seat as a panelist. In fact, that would be awesome. We're looking for ideas at Boys and Girls Club. So everybody, I'm sure, out there has some version of this. When we go through the identify a donor, and then interest and involve a donor, and then engage them, cultivate them, solicit them, steward them. So when you think about that good old fashioned, tried and true donor engagement life cycle, our life cycle has been blown to smithereens. And I bet all 35 other callers on this Zoom call right now are feeling the same thing. Certainly you can use phone calls, email, and Zoom to do the identify and maybe even interest. You know, you can send out communications, you can get on phone calls, you can get on live Zoom, you can exchange emails. Here's our information, here's what we do. I think that is maybe the least disruption. But man, when it gets into engagement and involvement, we are all in a new world. So literally our team spent hours this week in various subgroups and sub-team meetings trying to reinvent, not just for today, we're trying to reinvent the way we engage, solicit, and steward. Literally, how do you bring, what we used to do is we'd bring a person into the club, we'd bring them in to literally experience a club experience, see the kids, see the youth specialists. If you're with a performing arts organization, you know, you're bringing people into your hall. If you're with healthcare, you're guiding them on tours of the facilities. Schools are exceptional at this, bringing, you know, people into the schools and experiencing the mission. So how are we now going to do that in a virtual environment? And so we at Boys and Girls Club, we're of course the same exactly as Laura said. It's all about relationship, but that relationship requires a personal one-on-one sense of engagement. And we're trying to create that now in a virtual world. and anticipating maybe if this pendulum starts to swing, maybe the next move is, all right, folks, you can go back out and gather in groups of 10, but still say 6 feet apart. So we're saying to ourselves, great, how do we use iPhones and Samsung phones and tablets and technology to bring constituents into that experience that's 10 or more, 10 or fewer kids with the appropriate amount of adult supervision indoors and outdoors to become a part of that experience. And, in accepting, I spoke during this first web conference about just acceptance of the things we can't change. And right now, until a vaccine is created, we're going to have to accept some pretty severe social distancing guidelines. So to wrap up, I'll just say any ideas that are out there, if you want to throw them into the chat room or dialogue now, or put them on our website, for what are you doing to create virtual engagement opportunities, we're looking. And we're going to try some things, and we'll share out our experience and success with it as well.
Great. And if you put those in the chat room, we'll corral those as well, and or Q&A wherever you want. I think it's important that everybody share ideas. So Matt, do you want to move on to the next question?
Yeah.
Okay, so this one is pretty specific to Laura again, but I think this is kind of her values. She's very uniquely positioned at Stride, balancing the communications and development. So how do you do it?
That's a really great question. Sometimes better than other days, I can tell you that much. I think right now, and the way I look at this is, again, if I think of what we just talked about, which is the relational side of things, relationships can't happen without communications, right? So they really do go hand in hand with each other. You have to be able to communicate with folks. And it is hard. I mean, I think Patrick just alluded to that. It's really difficult when we know we want to get folks in the door and let them see firsthand the work that we're doing, and we can't. So taking the time to, make sure that we're sending out photos and we're sending out those newsletters and we're making sure that our donors and our supporters know how to engage with us on our social media platforms helps paint the picture of what we're doing right now. But if we're not communicating that, if we're not taking that really strategic, aggressive type of approach in communicating everything that's happening with Stride right now, we miss those opportunities with our donors. And so it really, I don't think you can do one without the other, quite honestly, John. I think we have to have both of those pieces in place. Right now, the world for us is really very communications heavy, because it's the outlet that we have in which to form relationships with people and connect to foundations and businesses that are helping support the work that we're doing. And so the communications in a critical time like this becomes a lot bigger burden to bear than perhaps the fundraising side does. But you still have to have that, and we still have to continue to work towards bringing those dollars in the door. So that there's not a really good answer for how it's balanced. It's just what we have to do and what we have to continue to do, because we know that the two coincide together. And again, without one, you can't have the other.
Great. I will jump into the next question then. Matt, would you mind? This one's the last question. This was the tough one. And Patrick, I'd love to have you answer this as well. And Matt, even if you want to jump in, but I love the fact that this one's going to make you think. What do you wish funders knew about Stride, or Boys and Girls Club of Denver, that you can't always convey through your communication? Maybe something that can be very blunt and candid that you could just let funders know.
Sure. So I think one of the biggest misnomers about community health centers is that, yes, we're a nonprofit health entity, but we're very, very different than a hospital is. And so a lot of times you'll hear that there's money trickling down from the feds to support hospitals, or there's bills that are being passed here in the state of Colorado that are supporting hospital transparency or payment reform and those types of things. We're very, very different in that respect, and that money doesn't always trickle down to the community health centers at the local level. And that's something that we don't get the opportunity to say in a grant application or with a donor. We don't talk about that. But it's important to know that there's a distinguishable difference between the two. The other thing I can say for us as an organization that employs 450 individuals and serves that 51,000 patient population per year is $5 million for us only covers 8 weeks worth of payroll. So we have a almost $36 million payroll for our organization. So those big grants that come in, they're not stretching as far as we would like them to, right? Every single penny counts for us, whether it's a $500 contribution or a $5 million contribution. It is all very, very critically important in the work that we do. But those smaller grant opportunities, those $10,000 opportunities that are coming through with some of our small local foundations here, it's a drop in the bucket for an organization like Stride. The money does not stretch as far, I think, as people think it does sometimes. So if we had a nice way of saying that to our donors and to our funders, we certainly would, because it's an important thing to understand as to how far that money can stretch. So those are really the two for me.
Really good point. Yeah. Patrick, what do you wish you could share with funders that you can't always convey through normal conversation?
Sure, I'll just briefly, because we've got some good questions coming up on the Q&A. Anybody who's ever heard me speak about fundraising, you've heard this come out of my mouth before. And again, I'm 100% confident we all share it. One of the most difficult things in Boys and Girls Club, University of Colorado Anschutz Medical Campus, the Des Moines Metro Opera, all the places I've worked, one of the hardest things to communicate is to trust us to do what we do. You know, you just can't say that to a donor. Please just trust us, but it's true. You know, in the case of Boys and Girls Clubs of America, they've been around for 160 years. I think there's evidence that they've been doing the right thing for a minute. And it comes down to 3 things: character and leadership, academics, and healthy lifestyles. And at a time of crisis, not only are we not going to change what we do, we need to fall back on our fundamentals. And I'll bet Laura's in the same position, you know, back to basic fundamentals, doing what we do well. And oftentimes, I don't know who to blame, Facebook or YouTube or who, but we've created a desire out of donors for something new and fresh constantly. And I think just reminding them to trust us that our fundamental mission is the most important thing we do, and staying focused on that is important. So I think we do a good job of communicating that, but it's always a challenge.
Great. Well, thank you, Patrick. Thank you, Laura. I think we're into the Q&A section. So Matt, do you mind taking it from here?
Yeah, you bet. So thank you, everybody, for your questions so far. And I'm just going to jump over here. Keep them rolling, please. You know, we really want to hear from you, your questions, your comments, your thoughts, and everything. And then also, you know, Patrick mentioned this before, and I'll share the Facebook page at the end of this webinar. Ideas, you know, what would you hear? We want to continue these through May. We want to keep them going even through June if possible. Just, you know, so we can ideate, we can have, understand how we can all get through this. But we really want to hear from you on what subjects, what topics, who do you want to hear from for these future webinars. So please let us know that as well. And again, we'll share that Facebook link. So the first question I'm reading right off the top here, I haven't had a chance to review all these. Jake from A Little Help. The mission is connect with older adults with our local volunteers to provide services and companionship. We have had an overwhelming number of new volunteers, 600 plus. Wow, Jake, that's significant in the last 2 weeks. That's a lot to deal with. We'd like to try to retain these new volunteers and turn them into donors as well. So a little volunteer to donor conversion. Any creative out-of-the-box ideas for ways to communicate with these types of folks that originally signed up as volunteers, but also might want to help, that also would want to give. So, you know, Jake's dealing with a tremendous amount of volunteers. That's a great problem to have, 600 in 2 weeks. And then also the idea of converting these volunteers to donors. And then I want to also put that out to the audience. So if anybody in the audience is dealing with this at their organization, please also comment and we'd love to hear from you. So I'm going to if Laura, if you want to be the first, if I can put you on the spot, any ideas on ways to help Jake here?
So Jake, congratulations. That's a ton of volunteers coming in a really rapid turnaround time, and kudos to you for doing that. That's pretty incredible. I think, and again, for me, it's going to go right back into the communications piece. You've got folks that have reached out to you because they feel a calling to the work that you're doing and they feel passionate about your mission. And so how do you continue to keep them engaged? And the first piece of that is the ongoing communications with them. I think, and I've worked with many, many volunteers in the past, you're going to find that there may be a handful of those folks that don't have the ability to give from a financial side of things, but their in-kind contributions that they're doing simply by being volunteers is important. You want to be able to recognize those efforts. You want to share in communications. If you have social media that you use for your organization, give those folks shout outs. Give them regular updates of what's happening with your organization. And as you go and you continue those communications, that's when you can start planting those seeds for, have you ever thought about giving a gift? $10 could help us do X, right? With $25, we could provide this for those individuals that we're serving. And start getting them connected to how their contribution can impact your clients long term, and what that value is. And the more that you communicate that, the more that you connect with them, the more that you give them opportunities to volunteer in different ways, you're going to find some folks that will be so attached to your mission and the work that you're doing that you'll absolutely be able to convert them long term.
Great, thank you, Laura. How about Patrick, Boys and Girls Clubs? Are you experiencing a increase in volunteers?
Unfortunately,
help?
Yeah, unfortunately we're not, but I add my congratulations to Jake. That's tremendous. We've not only because we've had to shutter our doors, and so we've not been able to bring people in. Jake, I've heard that from around the sort of just the milieu of fundraisers that this might be a good time to enroll or enlist monthly donors. And so if you could take that 600 plus and craft the communication around maybe the monetary value that they bring through their volunteerism, and ask them to continue that cycle through a monthly cash transaction. And I agree with Laura. I think you don't have to ask them to sign up for $250 a month. I think $10 to $25 a month. And the value of that is maybe more than just the cash. I think the value is that you'll come through this crisis with 600 plus new donors, new loyalty donors. And, we talk a lot about the feeding pool for major giving coming from those loyalty donor base. So this might be a time to grow your loyalty donor base of 10, 25, $60 a month. And that way you'll have that following coming through this. And then all of the communication advice that Laura gave, I second.
Great. John, any follow-up thoughts?
Yeah, I won't add innovation because I think you guys hit key points. I will add something that you don't think of is maybe the opposite of innovation, but just the processes. And we see this across the board. Make sure that you are capturing, you're putting into a system and a process, kind of what Laura said, you're developing that relationship. And then the second thing, and this is maybe more technical, but don't think of it as a technical explanation. Think of it as being nimble. So we had a school that was trying to use Zoom and then Google Chat, all this other stuff, and they migrated over to Facebook Live, and it solved everything. So just be nimble enough to figure out what kind of vehicle is going to work for you, and don't be so worried about the channel. Matt says this a lot. Don't worry about the channel as much as the outcome. And so as you look at these new innovative things to do, think about what's going to be your best outcome. That's all I'd add.
Great. Yeah, absolutely. Look at that channel.
And also housekeeping. I put up Facebook pages, Boys and Girls Club, Stride, AFP Colorado, Colorado Nonprofit Association, and then MPW. We have a Facebook channel just for COVID.
Great. So check out that on the chat or all those Facebook links. Liana, I think it's Liana, has a great comment here. It's so true. this is around balancing and developing long-term relationship building with fundraising for immediate relief. So that kind of balance between immediate cash in the door and asking, and then building long-term relationships, which we all know is so important and so crucial to our work. And so they're changing at her organization. They're changing their communication strategies, and so they're just checking in with donors, which I think a lot of us are doing. Usually, it's the question about how the world looks and how it's affected that will lead them to return the question of how we're doing and how our work is affected. So, engaging that donor first, and then they're coming back wanting to know how you're doing. Of course, naturally, it's human instinct. And it's really a chance to get more info on, how the organization work aligns with the donor based on what they tell us and what they ask us about. And then you have this permission during each phase of the conversation to proceed, keep talking, and the donor is in the driver's seat. So you reached out to the donor, ask them how they're doing, and the conversation just morphs along these lines. And they do ask how they can help. And that happens a lot. And I've seen that occur, and it's occurring with some of the clients we work with, where the executive director or the vice president of development has reached out in the same vein. And the conversation slowly morphs to the donors interested, well, what can I do to help? I'll throw this out to Patrick first. I'm sure he's having these conversations. I'm sure you experienced the same thing, or any thoughts on Liana's comments?
No, I think I'm going to print her comment and frame it. Seriously, Liana, really well stated. I just love this line. This is a chance for more information on how our organization's work aligns with the donor based on what they tell us, what they ask about. Also asking permission during each phase of the conversation to proceed and keep talking. I mean, I remember last week, I think it was, I was in a conversation with some of my colleagues, and we were laboring over, the gift process and how much to ask and when. And I don't remember, but one of us just finally sort of did a forehead slap and said, wait a minute, shouldn't we just ask how they're doing? And it wasn't because we're insensitive. We just, we get into our work rhythm and we think, move, go. We're high achievers, all of us. So your point is just so well taken, that when we genuinely and authentically reach out, because they are our family, they're our extended family. How are you doing? How are you coping? It leads them then to return and reciprocate and say, thanks for asking, how are you guys? And that flow, I just think, is beautiful. So well stated.
Yeah, great. Absolutely, Patrick. Any other thoughts? Laura, any on the comment, or John?
No, it was incredibly well stated. We could all frame that, I think, Patrick.
Here, I would just say, yeah, the same. People are different places, and if you can, figure that out ahead of time, that's great. And sometimes it's as simple as, hey, we're going to do a catch-up call on and if you can, I would say this: try to have as much person-to-person contact as possible through Zoom. I'm finding, and I think our clients are finding that, and people I talk to, that the more kind of face-to-face contact, even if your hair is a little disheveled or maybe showing a little gray or whatever, go for it. So that's, yeah, just a little. That's the only thing I would throw out there too.
Great. This next comment is on TikTok. I don't know if you have a tween, you're very familiar with TikTok, or a teen. I have a tween. It's the bane of my existence. But it is a great medium, I guess. I'll tip my hat to that, and it can really help. And it's a lot of fun. And so Sarah is sharing a link here. And it's a fun way to keep our community engaged. So that's great, using TikTok for these purposes. And do a short video of them doing a routine chore, but with a twist on it, and put a video together. So she shared this link. I am not going to go to it. But please feel free to look at it. But I it begs that question. It's that use of social media, whether it's Facebook, Instagram, TikTok, but just engaging your audiences in really creative or different ways. So I love it, Sarah, that you've got these videos of people doing a routine chore with a twist. So I'll check that out later. So Patrick, Laura, any use of social? You talked about social media, Laura. What do you think?
Oh, absolutely, for sure. I think one of the things that we found is hugely successful for our organization is Facebook Lives. So anytime we get a chance, whether it's again deploying a new service or just talking to some of our employees about what they do and how they do it, we've had a lot of success with that piece. One of the other things that we did, and it shifts away here from donors, but really focuses on employees, is we were trying to figure out some unique ways to also make sure that employees know how valued they are. So I actually took the time to reach out to our members of Congress, our Mayor Kaufman and Aurora, as well as some of our state senators and representatives, and said, hey, would you guys be willing to put together a 30, 60, 90-second video thanking the employees at Stride for all that they do in the community right now in addressing this need, because they're working tirelessly, right? They're on the front lines, they're being exposed, they're dealing with people who are very sick and just not well. And so we want to make sure that they're recognized as well. And so we've taken the time to do that. And we got a great return on that from our elected officials and even some members of the Denver Broncos, just by putting posts on social media and saying, hey, would you do this for us? Or sending out those personal invites. And we're really excited about that because it gives us a way to share that story and share the reach of the work that we're doing with our employees as well as the community. So I think anytime that you can use social media in those really creative ways is the way to go. We're also getting ready to launch Instagram because we are going to do a virtual 5K event. We were supposed to have a 5K on May 9th and we can't do that, but we're going to find a way to do it virtually and try to raise some additional funds. And so we're going to tell the story through people sending us photos and videos of them running on treadmills or running on a trail in their neighborhood while practicing good social distancing. Folks do all of that too, but figuring out those ways to paint the picture and create the story. That's absolutely a good way to go.
That's great. That's great. Thanks, Laura. Yeah, that use of, I'll call them social influencers for lack of a better term. That's quite the buzzword these days. But, it's using, celebrities, elected officials, Denver, sports figures, things like that, that can really connect with your organization, get the message out, connect with people at this time. One of our clients, Soul Child Development Center, is fortunate enough to have two folks that are helping with their Champions Luncheon, which has gone virtual. And their ability to communicate and leverage their networks is tremendous, just tremendous help. And Patrick, I know Boys and Girls Club also benefits a lot from what would be athletes or social influencers.
Absolutely. And then this is sort of a stay tuned. We talked this week about using Facebook Live because we are doing virtual programming for our families and our kids. And we are going to experiment with doing some of that playful programming for our donors and corporate volunteers. And so we're going to ask them to participate in some of the fun activities we have our kids doing, kind of along the lines of, do you know as much as a fifth grader? So we're going to be playful with it. And the whole idea is to have them do activities. I love this comment in here that Sarah said, asking them to video themselves doing routine chores. So that's kind of the culture we're in right now. Jimmy Fallon is doing live Tonight shows from his home. John Krasinski is doing this great The Good News channel from his home. So yeah, let's get into people's homes. Let's be casual. Let's be playful and kind of fun about it. And the performing arts organizations are way ahead of us. I just saw a great virtual performance by the Colorado Symphony of Beethoven's Ninth. It was really cool. So any way we can engage people in our mission through Facebook Live or TikTok, I think it's all for it. And again, when you have those examples, please share them.
Excellent. And John.
Yeah, real quick. I just saw Catherine put in a great Q&A about furloughed individuals. And this is a little bit along the lines of what we're talking about, which is what are the resources we have? What can we do? And yeah, we talked about the technology channels, but what about the people? Are there people in the community that actually can help you that have the ability now? And there may be good development directors, program people, you name it, that just unfortunately have been furloughed. Tap into your network and say, hey, can you help me put together a webinar? Can you help me? I mean, that's what Matt and I did. Patrick, can you help us put this on? Kay, can you? Laura, can you join us? So I would just say, when we think about what we can do, don't just think about what Facebook Live can do, but maybe think there are people out there. So great question or point, Catherine.
Yeah, absolutely. Yeah, thanks for that comment, Catherine and John. very relevant. I don't know, Laura, Patrick, any other thoughts on nonprofits trying to redirect professionals who've been furloughed? Or
Yeah, Matt, we're fortunate at Stride. We have not had to get to the point of doing furloughs or layoffs, which is great. And again, a lot of that just comes back to the work that we've been able to do to secure immediate funding for the organization in our time of need right now. But we have had that conversation about how could we bring folks in a volunteer or temporary basis where we do have gaps, because what we know right now is that any kind of plans we had to hire additional staff, we can't do. We want to continue to maintain and sustain the existing employee base that we have. And although we would love to get to that point of being able to hire positions that we had been looking at for this year, we're not there yet. So how can we bring in, as John said, how do you bring in folks who may not be working right now, who have those critical skill sets that you're looking for? And if you can tap into them, I totally agree. Absolutely do it.
Good. We've got, I just want to, Liana put something else, just want to recognize their use of social media, Facebook Live. Facebook Live is really getting popular and is a real powerful medium, and we keep meaning to put these on Facebook Live, but just haven't figured it out yet. One day. But they're using cooking demos with native chefs, quarantine cooking, indigenous ingredients for pantry recipes. So a lot of, she's with the American Indian College Fund, incredibly mission connected. So lots of ways to connect that mission with all your social media activities. And I'm asking, this is going to transcend the coronavirus crisis. I mean, this time next year, knock on wood, we're going to be back. We're all going to be, we'll be able to have events. We'll be able to have all these things. But people will still be on social media and still be using Facebook Live and all these mediums. So what a great opportunity right now to pilot these programs and think about them and activate them. And, not everybody is still going to either want to go out, not everybody can go out. And just a way to continually connect with all your stakeholders and all the people involved in your organization and grow your audience. So I think this is actually a terrific time to really build your social media experience and kind of test and pilot all these creative ways that are out there. And again, you can be very mission focused. I had one more comment from Patrick Hayes, and it's incredibly well stated. I think it's a great place to end on. And as he says, those in philanthropy, so us, all of us fundraisers, all of us working to bring revenue into our organizations and build relationships and bring people into our organizations, should not underestimate the purpose of meeting that many people are seeking right now in our isolated state. People are feeling disconnected and isolation at home. And just the simple act of reaching out to someone is such a healing action that you can really take. And for others and for you as a philanthropy person or fundraiser. And you're seeing lots of evidence among our community donors and volunteers in the broader community. So true, Patrick. I mean, that is it. I mean, and I've said it, we are on the front lines. There are people that are so connected to our organization and they get so much from it. And that we have this ability and we have this purpose and it's our job to connect with them and reach out during this time. And I think they are seeking it and they want that.
Matt, can I add something to that?
Please, Laura. Yeah.
I think an example of that, I sit on the board of a nonprofit here in Denver that grants wishes to seniors all around the United States. And they have a campaign just like that where they've said, we have so many seniors that are isolated in their senior living communities right now that, they can't get out, they can't congregate for a meal together. And so how do we start connecting people? And just to that point, they created a campaign around getting folks to volunteer to make phone calls to those wish recipients that they've touched in the past. And I actually had a donor of ours here at Stride who said, hey, could we make some phone calls to your employees? And I said, we're not quite there yet, and that's not necessarily a need that we have immediately, but let me connect you to this other nonprofit who's looking exactly for that. They're looking for volunteers to help. So I think you guys are right. There are numbers of nonprofits, maybe not your own, but there are others in the community that need that type of support to help do that outreach. And it really is a great way. It's a good way to feel good right now in times where we're not always feeling positive and optimistic. So absolutely.
Well said, Laura. Well, really well said. No question. I am going to go back to sharing my screen here, and we are going to, if Janie is still with us, I will take it, we'll bring it over to her to close out for us. Thank you. I just want to say, I'll let Janie give some closing remarks. We got, but first, our upcoming webinars, there's the link. John shared the Facebook page on the chat, and we can also share that again. And so we've got Jen Darling of Colorado Children's Hospital Foundation coming up next Friday. Is a not miss seminar. Should be great insight from Jen. She's incredibly, as you probably know, incredibly experienced fundraiser and leads a huge team there. And we also want to hear from you. What seminars do you want to see? What topics do you want to see? Please let us know. You can put it on our Facebook page. Or just send us an email. I'm sure you know us and have our email. But please let us know. And here's what's coming up at AFP Colorado over the month of May. Janie?
Yeah, I just want to remind everyone we are having a virtual happy hour. Speaking of going virtual, on May 6th at 4:30 p.m. It will be led by Ann Goldman and Leslie Allen. And you can learn more about engaging your board as a fundraising team. So mark your calendars May 6th for a virtual happy hour. And then Friday, May 15th at noon, we are having a webinar with Carla Rains from Corona Insights on winning your donors' affection with strategy that matters. So those are our two upcoming webinars. Again, AFP Colorado has devoted an entire resource page on our website to fundraising during coronavirus. So visit afpcc.org to learn more or to become a member if you aren't already.
Thank you, Janie, and thank you so much for your partnership. And I also want to be remiss if I didn't mention Colorado Nonprofit Association. They are doing a tremendous amount right now. They have some COVID-19 pages related to what to do during this time of crisis for nonprofit. On LinkedIn, on Facebook, they're doing a lot of trainings. We can provide that link as well when we send out the recording of this. This has been recorded. So if you had any technical difficulties, you of course see the recording. Great stuff with AFP, some two great events. And thank you, Laura, so much. Thank you for the wonderful work of Stride. Amazing things happening there. Such an important part of our community and such an important service right now during this crisis. And John and Patrick, of course, thank you. So if no other ado, have a great weekend, and hopefully we'll see you next week. Webinar with Jen Darling. Bye-bye.
Thanks, everyone.
Thanks, guys.